Doctors of Reddit, what is a 1 in a million chance thing about your patient you have witnessed? This is a true moment straight out of House MD. It both illustrates how straight up dumb luck can determine whether we live or die and how well trained and observant some professionals are. A neurologist I was rotating with once was walking to the parking lot through the emergency department, and one of the docs stopped him and asked him to do a quick look-see on a lady he was about to discharge home. We call these drive-by consults. This woman had some vague, non-specific complaints like headache and passing dizziness, but nothing out of the ordinary, and all test and came back negative, so she was waiting for discharge. Neurologist spends 5 minutes with her, comes back and says admit this woman and do a stat MRI of her brain. He noticed an extremely subtle vertical nystagmus of her eyes. A nystagmus is basically a repetitive, uncontrolled movement of your eyes which can have dozens of causes. A horizontal nystagmus is what you'll see 99.9% of the time, and it's usually benign in origin. Vertical nystagmus, on the other hand, is a stroke in your cerebellum until proven otherwise. They sent the woman to MRI which showed infarcts in both sides of her cerebellum, and she was in neurosurgery the next morning. If it weren't for that drive-by, she would have been sent home and probably died overnight. My father is an anesthetist. I remember his 1 in a million, way more rare actually, thing happened when I was like 13. He was knocking a patient out for the surgery, did the pre-op stuff. The woman's consultation earlier showed no flags for anything major. She had a reaction, which can happen, such as malignant hypothermia, but this wasn't that. Her reaction to the medication was where her own skin started to split and peel away from her body in large chunks. Her own body was rejecting her skin. The woman spent quite some time recovering. There was an investigation into the whole thing, but everything was done by the book and there was no reason for this to happen. The drug company was contacted and they had never heard or seen about this happening with any of the drugs. Drugs were taken and retested. This went on for a while. Turns out it was an allergic reaction to the drug, and it's just the way it presented. It was so extremely rare no one had seen it with the drug that has been in use for decades all over the world. My father ended up writing a paper on it. Edit. We'll see if the paper is online or get the info on the journal it was published in. Was almost 20 years ago. I was a paramedic and I came to a scene where I had a patient who was talking to me, but he had no blood pressure and no detectable pulse. I couldn't even hear his heartbeat with a high quality stethoscope. They dumped a few bags of fluid in him in the emergency department before they were able to get a blood pressure on him. This was years ago. Saw a teenager, 16 or 17, have a heart attack. Jacked athletic kid with 8-pack abs fell on the ground clutching his chest during basketball practice. Everyone in the pediatric ER thought it was a panic attack except for the adult ER resident who said, "I've seen hundreds of heart attacks. He's having a heart attack. Don't ask me why, but that's what this looks like." And that's what it was. He had an inborn anomaly where one of coronary arteries coursed between the pulmonary artery and the aorta. During exercise, the aorta and pulmonary artery expand with the increased cardiac output, and for whatever reason, that was the day that they squeezed the right coronary artery and caused a massive myocardial infarction. It was bad news bears. The damage was so bad, kid needed a heart transplant. He was transferred to a pediatric heart center. A left ventricular assist device, LVAD, was implanted because his heart function was so poor. A donor heart was found, and as he was being prepared for surgery, his own heart decided to suddenly start working again. It turns out that hearts can heal after a massive heart attack, especially teenage hearts and ripped, athletic kids with 8-pack abs. This was only discovered after the advent of the LVAD, because prior to that, nobody would live long enough to recover. At the time, I think this kid was like one of the first 10 pediatric patients to get an LVAD at that hospital. So the kid had to get his coronary artery reimplanted so that it wasn't going to get squeezed like that again. But he got to keep his heart, and I hear he recovered and returned to playing basketball.